Thanks for being with us.
Yeah, can we start the session?
Yes, film
Yes,
has
please.
been started, so you can go ahead.
Yeah, live started already. Shall I? Hello everyone, this is Mahesh. Our team DPWD, Diksuchi for Persons with Disability team, is welcoming you all wholeheartedly to this national-wide webinar on physiotherapy uh, and also opportunities for visually challenged in physiotherapy and its related fields. And also the success story of Divya Bijur, who is the speaker of today. Let me give the agenda of today's program. Some technical instructions to all the participants and introduction about the speaker. One of our teammate, Shivani, is going to introduce the speaker to this webinar. And after that, we have a speaker speech on today's topic. After all, we have a Q&A session. You guys can ask any questions, doubts, and take suggestions from the speaker. After all, we have a vote of thanks. One of our teammates, Mr. Ganesh, he's going to conclude the session in a formal manner. After all, you guys can interact with the team. You can give your suggestions, feedbacks, and interact with the team DPWD. We are our team very happy to know that you guys are showing a lot of interest to participate in all our support and sorry. Thank you all for encouraging in this way. So far, our team conducted many webinars on different themes. This is the webinar going to be the 24th one. Thank you all for our support, active participation in all our sessions. So some we have technical instruction to all the participants to run the session in a smooth and effective manner. First one we have is if you want any ask any questions, please just raise your hand. Then only our team will unmute you and you can ask the question. Second one, I request everyone please try to be in mute always so that it will not create any disturbance in the session. And after that, you can also comment your question in Zoom chat box and also YouTube comment box. One of our teammates will read your question on behalf of you. And after all, I request everyone please try to join with your own name so that it will not create any disturbance in the session. Without any delay, now I request Shivani to introduce the speaker to this webinar. Over to you, Shivani.
Yeah, thank
Yeah, sorry, Sivani, unmute yourself and talk.
yeah. Am I audible to everyone?
Yes, go ahead.
Yeah. Good afternoon, one and all, and good afternoon to all the special dignitaries. So, yeah, as you have already heard, we have successfully completed 23 webinars, and today we have stepped into our 24th webinar with such an inspiring and interesting topic. So, first of all, I would like to thank Srinivas Chakravartula sir, because of whom we could have such an inspiring speaker with us today. So I also would like to thank the speaker ma'am, Dr. Divya ma'am, who have accepted us our invitation and joined with us. So today our speaker ma'am is very inspiring and we have to learn a lot of things from ma'am. So Dr. Divya ma'am is a physiotherapist, a physical therapist, and has two clinics at Vasai Asrab of Mumbai since November 2010. Ma'am has also done diploma in physiotherapy, DPT bachelor in orthopedic rehabilitation, and also Divya ma'am is a Vishad Sangeet Vishad from Gandharva Mahavidyalaya in Hindustani vocal classical music. She is visually challenged since birth, but nothing comes in the way of her dedication and determination. So we are very fortunate to have you with us today, ma'am, and and also we are eagerly waiting to listen to your words, and we would like to know a lot of things from you, like in spite of the disability, how did you manage to reach such an high position, great heights in your life. And also, we are very eagerly waiting to listen to you. And without any much delay, I would like to hand over it to you. Thank you.
Hi everyone, can you hear me?
Yes, ma'am. You
Yes,
can.
ma'am. Go ahead.
Okay, hi everyone, and first of all, congratulations to your lovely team, and thank you so much, Shivani, for this lovely introduction, and thank you, Srinivasu, for um, seeing to it that I'm invited here today. And I feel that I'm just here to share what I did and what I'm doing. And I feel all of us are here to motivate and inspire each other. So we all have our mutual ways of inspiring and motivating each other. So I'll just begin with my story in short. And then if you all have any questions at the end, you all can, of course, ask me. So, like Shivani told you all, I'm blind since birth. My father is himself an eye specialist. He's an ophthalmologist. And my mother is an anesthetist. That is, when you make the patient unconscious for an operation, she's the doctor who does that. And my sister is now a gynecologist. So when I was small, everyone in my house, like, of course, my sister was also small. She's like 3 years elder to me. But everyone in the family was a doctor. And my greatest fortune is that I was accepted not just by my family, but also by my extended family. And so also by the people around me. Of course, we all have those weird experiences where, people tend to let us down, but that's fine. We all are strong to, come out of it. So after my, when we start with our schooling, there was this question that, whether to enroll me in a special school or in a regular school. But the National Association for the Blind is an institute that has, of course, many branches in India. So the Mumbai branch motivated my mother a lot to enroll me to a regular school. And they saw to it that I was enrolled into the integrated education program, where there was someone called resource teacher who would come and teach me Braille. And then eventually she even started teaching me rehabilitation skills, like, of course, mobility and daily living skills that generally people in special schools are taught in their schools, right? So, and in the school, I would have a scribe, I would have a writer. And so after my SSC, everyone wonders how to go about your career, what to do going further. And I was also learning music since childhood. So music was also another, career option that I was considering. So I had been to a career guidance seminar that was organized by the National Association for the Blind. And there I met a senior physiotherapist who was also practicing in Mumbai. And I thought that if he can do it, even I can do it. And I certainly wanted to choose a medical field because I was really interested in it. So I thought that physiotherapy would be the best fields because most of the information that you need is gathered by therapeutic touch, it is called. So when you touch the patient, and of course, from what the patient tells you. So I thought that I want to do physiotherapy. And so I joined a diploma course in physiotherapy that is run by the National Association for the Blind in Mumbai itself. It is run. Two physiotherapy courses are also run in Ahmedabad. They are also diploma courses run specifically for the visually impaired. So they enroll only visually impaired students. And they have professors who have specific experience in teaching the visually impaired students. So it's a very nice foundation I got, I would say, in physiotherapy. Simultaneously, I had also enrolled myself, like when I was at this transition of school and college, I had enrolled myself with an institute called Hadley Institute that is based in the US. And they conduct many distance education courses that are not necessarily related to physiotherapy or health, but there are varied topics like health, like sciences, like even the human eye, or daily living skills. They also have many braille courses that are really wonderful. um, and now they have even many discussion groups, and of course, even from Hadley School, I started my Spanish study. So of course, that was Spanish I just started recently. But yeah, I have been associated with Hadley Institute since quite some time as their student. So the diploma course was really nice, and it was really catered to the visually impaired, I should say. But after that, I wanted to do a course that is a mainstream course, that every sighted physiotherapist would do, because there was no higher education physiotherapy course meant for specifically for the visually impaired. So I did a lot of research, because back at that time, like say in 2004, 2005, there was no visually impaired person who was allowed to enroll in a physiotherapy course, in a mainstream physiotherapy course, because at some places there was the common entrance test. Some places it wasn't there. It was not as standardized as it is now. Because now to enroll into any medical course, you have to give a common entrance. And of course, now, since the last 5-7 years, there's also a verdict that a person who is visually impaired can give the common entrance test. That's at least the case in Maharashtra. I'm not really aware about the other states. But yes, that verdict is out now. So any visually impaired person can give the common entrance. Um, but back then, of course, there was no concept at all of enrolling a blind person with other sighted students in a physiotherapy course like they were enrolling us in schools. So, and I found out that this is being done in the UK since quite some time. Since the early, like 1914 and all. So I emailed to them and I spoke to them. I went to the University of East London and the University of Birmingham in the UK. And I learned a lot from them about how the students there, what help they receive, or probably what modifications they receive as far as physiotherapy goes, or what assistance they receive when they are giving their exams, or many things like that. And then I came to India and I joined my bachelor's in physiotherapy, that is called BPT, with Sikkim Manipal University. Because back then I was not allowed to give the common entrance in Maharashtra. Whereas many other universities, like I said, were accepting the 12th science marks. So I did my 12th science first after my diploma in physiotherapy. And later on, I enrolled for BPT, that is a 4.5 years course. It's a 4 years of academics with, of course, with the clinical postings and 6 months of internship. And of course, simultaneously, I was also learning technology and I was enhancing my Braille reading skills. And I am an avid Braille reader. I love to read Braille. And I also learned JAWS quite earlier in my school days. Because, of course, as we all know, technology is something that really helps us a lot. So when I was in my physiotherapy college, I was giving my assessment exams on the college's computer, which was very fast and which was very advantageous. But of course, for my university exams, I would have a scribe, which was like fair enough. And because I had done, I feel that, because I had done a course that was catered to the vision impaired, this course was, I won't say easy for me, but yes, it certainly gave me a lot of confidence to even ask my professors if I had any doubts, and, how to ask, because my professors in my bachelor's college did not have any experience at all of teaching a visually impaired person. So, um, I'm not proud of it or something, but yes, I'm really happy that I could um, build that much of awareness that, how to teach a visually impaired student, I should say. And eventually they did a really great job. And I too worked harder, because of course we all know that, all of us have to work harder than our peers. And I feel my hard work really bore fruit, because in my final year, in my physiotherapy final year, I topped my college amongst 90 students who were sighted. So that was a real proud moment for all of us, because even I had not expected that. And as far as dealing with patients goes, because in physiotherapy it's not just academics, you also have to deal with patients. You have to give them confidence that you will treat them. And generally when I was in college, like in the initial days, because of course all of us are learning, my friends around me were also learning, so patients would generally tend to compare, that, oh, she can't see and her friends can, so how will she treat me? But then I feel we have to, sometimes prove ourselves, and give those patients that confidence, patients or anyone for that matter, any field any one of us chooses. But yeah, if we talk about physiotherapy, then yes, patients in particular, we have to give them that confidence by talking to them, and by explaining to them, and by trying to understand what they are saying. So it's always like a two-way process. You have to be a good listener also. And after 6 months of internship, I did 6 months of like practicing in other clinics here around Vasai. So I live in a suburb of Mumbai called Vasai. So it's quite close to Mumbai. I would say it's around 60 kilometers from proper Mumbai. So in those clinics, I got a very good experience of how to do decision making. Because there are many visually impaired physios here also in Vasai, like in Vasai, in areas nearby. So I was very fortunate to work under them and to get a lot of guidance from them. And then I started my own clinic in 2010. So I have two setups, and I go to one clinic in the mornings and I go to the other clinic in the evening. And I would also do home visits earlier. But of course, now with this current times, I'm not doing home visits, but I started my clinic in May again, and with all the precautions. So of course, it's always said, that life is never like, a straight line. It has to be curvaceous, otherwise it's not life. So we tend to have changes that we have to make. We have to adapt ourselves constantly to the changes that set in. So earlier, because like all of you know, wearing gloves significantly masks our sense of touch. So earlier I was very apprehensive about how I'll be able to treat patients with my gloves on, whether I'll be able to feel, uh, but now I'm really used to it. And I think it was really, great of me to come out of my comfort zones and do that. And I know many people are doing that, and we are always a support to each other. So um, that something I think is something we all in our respective fields overcome. We overcome obstacles all the time. And it's very nice to be updated with the field of physiotherapy, because there's a lot of research going on all the time. There is a lot of evidence-based treatment, it is called. So when we do a research and find out that this particular treatment is very effective, or is effective than other forms of treatment and things like that. So as physios, we have to constantly update ourselves with the new techniques, or with the new research that keeps happening. Like many of you probably know that people who are in the IT or the software development, they do have to keep updating themselves. And all the time we are also, getting updates of apps. So, and nowadays technology also helps a lot in that respect. So during my college days I would have to record lectures and take notes on computer or braille or something. But now there are a lot of ebooks, and so I think um, if anyone wants to do physiotherapy now, it's much easier because there are a lot of ebooks available. And um, of course, every period of time has its own challenges, but yeah, now certainly books are more accessible, I would say, because access technology is growing day by day. So it's nice to be updated with physiotherapy, and it's also nice to pursue music as a hobby. It really helped me de-stress a lot during my academic days, and it still helps me de-stress a lot. And yeah, and I also love to read and to travel. So my parents are also very fond of traveling, so we have traveled a lot in India and abroad. And I love to watch movies, especially audio described movies. And yeah, I love to learn languages. And I think language is a very good way of connecting to people, right? So when you talk to somebody in their mother tongue, it really touches their heart, I feel. And I love to learn languages not just to give patients that comfort and confidence, but of course also to connect with other people. So yeah, I speak quite a few Indian languages, and I'm also learning Spanish and Greek. And Spanish I learned from the Hadley Institute, and I'm continuing my Spanish lessons on an app called Duolingo, that is a language learning app. And yeah, that's it from my side. I think if anybody has any questions, y'all can surely ask.
Thank you, ma'am. Thank you so much for the valuable information. Guys, if you anyone interested to ask any question, please raise your hand. Then only I can allow you to unmute yourself.
While people are getting ready with their questions, I must tell you guys, physiotherapy is actually one of the very popular career in Mumbai, and that's kind of place I've seen very successful physiotherapists, including Dr. Divya. For the first time, I called her as Dr. Divya.
Mhm.
So it's actually one more opportunity that people can explore. It's actually a wonderful thing.
Yes, and all over, I think physiotherapy has a lot of scope now because there's a lot of awareness amongst people, So earlier, like around seven,
Yeah,
8 years
one quick
ago.
question. Divya, now that okay, the touch is the primary thing for physiotherapy. Now this post, how is the situation post the during and post COVID-19 for you guys?
So yeah, so I opened my clinic in May. So there was this severe lockdown from 22nd of March. And back then, the disease was not so well understood, also. I think people were very apprehensive, and that worry was really natural and very genuine, I think. So I had not opened my clinic until May 4th. And of course, I opened it with due precautions. So I wear a gown and gloves, and of course, the mask and a cap, and there's something called as a shield that would cover your face and your eyes. So earlier that seemed quite a lot of a hassle because of course the touch is altered when you touch the patient with gloves on. But now of course I've got really used to it. So earlier I used to feel that how I'll do that, but yeah, once I dived into it, I started getting really used to touching patients with my gloves on. And now it's like a second nature. Like I don't feel that, oh, I'm wearing gloves and, treating. So I think changing ourselves also helps us a lot in many situations like these.
Fabulous.
Yeah, there is a question from Shivani. Shivani, please ask your question.
Yeah. Good evening, ma'am.
Good evening.
Yeah, I'm Shivani. So, ma'am, you said you are even learning Spanish, and also you are chosen a career that is really, really different from, different that we can see these days. So, what made you to choose physiotherapy, and what made you to learn languages as well?
um, Physiotherapy is like, my mother and father are doctors. And since I was very young, I used to see them in their profession. And, I used to love to imitate everyone around me. So, and those days we had these landline phones. Of course, now we have them, but now they are getting a little obsolete in the times of mobile. But those days, the landline phones were really important, So uh, I would listen to my mom speak over the phone and, telling her how, I would hear her tell the nurse, how to ready the patient for an operation. So, and when she would go away, I would try to imitate her in front of my granny. So, my granny also knew that, I had a great affinity for medical field. And even in my school days, I used to love science and human body and all that. And so I primarily wanted to choose a profession that was pertaining to a medical field. But of course, a field like MBBS involves surgery. And in the US, people are able to do, have their medical graduation without opting for surgery, but that's not possible in India. So I know many, like a few intensivists, people who work in intensive care units in the ICU who are blind. They work in the US. So, but of course, it's okay. Like, I think some things are destined, and I really love physiotherapy and I'm really passionate about it. So, basically, my interest and my passion, and the fact that touch is going to be a major factor for me to understand the patient. Touch and speech, so when you speak to a patient, or even the way the patient speaks can give us some idea about what can probably cause this particular speech impairment. So that's a very important thing. So I knew that I won't have to be dependent on someone, for someone to tell me, okay, what's the patient's color of his or her eyes, or the color of their nails or something. So I knew I won't require like sighted help to diagnose a patient or to treat a patient. And that's why I thought this was the best field, physiotherapy, for me. And I feel I'm very happy and passionate to be a physio. About languages, so when I was at school, and even like around our neighborhood, so in Vasai, it's a very cosmopolitan area. So we have people who speak many languages, and we have people speaking even different dialects of the same language. So if you say Marathi in Maharashtra, you have people who speak different kinds of Marathi, So, and I was really interested in those dialects. And so from my childhood, I had, like, not taken any special efforts to learn languages, but I had also learned some Kannada from a helper whom we had, who used to come to our place. So I learned counting in Kannada and some sentences. And then eventually, when I went into physiotherapy, I realized how important a language is, because, my physiotherapy friends are all Gujaratis. So I started speaking with them in Gujarati, and eventually I learned that language. So now when I speak Gujarati to my patients, they actually think my mother tongue is Gujarati. So my mother tongue is Konkani, and Konkani is a language that is spoken in Goa and Karnataka. And yeah, so, and of course, even in Konkani, there are different dialects. So the Goanese Konkani is different, Mangalorean is different. And when I joined Hadley Institute, Hadley had a conversational Spanish course that I was thinking of taking since a very long time. But then, because of my academic obligations, I was really hesitant to take up that course because that was quite a long course and I thought it was quite demanding. They also had a conversational French course that they stopped, unfortunately. But yeah, I was very fortunate to get hold of the conversational Spanish course because now they have changed their pattern of teaching a little. So they don't have like, they have Braille courses, of course, but they don't have like, assignments and instructors and all that for most courses. They have these informative videos that are shown to the viewers, and then they would take like your opinion on, did you learn something new from this video, things like that. So they are trying to change their methods of teaching, basically, because they have a lot of people who lose their vision at a later age, and so they are not really, they don't really comply to these kind of long courses. That's what they observed. So now the Spanish course is not there either with them, but that actually kindled my interest in Spanish and into languages per se. Like my interest actually deepened, I should say. So they have a Spanish chat also every Thursday. Uh, so it's fun to, the instructor who used to teach Spanish, she takes a Spanish chat for an hour and 15 minutes. And of course that's for different levels of Spanish, so she's very relaxed about it. It's not that it's the whole thing is in Spanish and all. So that's a lot of fun. And so now technology really helps us in whatever we want. So I was just exploring this Duolingo app for different languages, and I found Greek, which is one of the ancient languages. So I'm very fascinated by Sanskrit, and I try my best to learn conversational Sanskrit, because Sanskrit is the mother of all our languages. And of course, we should know Sanskrit, is something I feel very deeply. So Greek also really interested me because most of our medical terminologies have their origins in Greek. And so even now when I learn it, I find many words, even in English, there are quite a few words that are borrowed from Greek. So it's a very interesting language. And I hope to learn more languages in the future as my hobby, as my passion. So yeah, that's it, I think.
Yeah, thank you, ma'am. Next question is from Anirudh. Anirudh, please unmute yourself and ask your question. Yeah.
Yeah. Hello. Hello. Am I audible?
Yes, you are audible.
Yes.
Go ask your question.
Yeah. Very good afternoon to DPWD team and Dr. Divya as well. I'm Anirudh Rao. I'm working as an English lecturer in a private college here in Bangalore, and I'm also a language enthusiast and even the science enthusiast as well. And actually, I had a question to Dr. Divya, and this is, to inform you all, this is my first webinar in DPWD, which I'm listening from DPWD actually. And I congratulate all the team actually. Yes, coming to my question, see, Dr. Divya, actually, the problem here in India, what I have heard from my friends, visually challenged friends here in Karnataka, is that we are not allowed to take science stream in the college. And to get into any medical field, actually, it comes as a challenge that you have to have your 12th in the science background. And when you do not have the 12th in the science background, they may not admit you to the medical courses. Especially with the experiments in the biology and the diagrams in the physics and chemistry, again the experiments in chemistry and everything, they think that for the visually challenged or the blind, it is difficult to pursue the science. So I do not know whether you have mentioned about your this fact earlier, because I was late to attend to this webinar. So can you throw some light on it? how you could crack science, or did you go through the science background, or what it is?
Yeah, right. So that's a great question. So, yes, I did my 12th science to get to the bachelor's of physiotherapy. So, here in
Mhm.
Maharashtra, like even when I was doing
Now,
12th science,
mhm.
they had some
Actually, I do
accommodations.
not know. Can I just, yeah, I do
Yes,
not
sure.
know how it is in Telangana or Maharashtra. Here, actually, the problem with the special schools is here in Karnataka, we are not taught science and mathematics after seventh standard. That is the
Okay,
main problem here
I
in
would,
Karnataka.
okay, this is Srinivas. So, hi, Anirudh. So nice to meet
Hi,
you.
hi,
I would just
Srinivas.
add some things here. Now the situation,
Uh-huh.
whatever you said is quite right, which is
Yes, yes.
happening for many years. But now the
Mhm.
situation is getting changed. In fact, in Bangalore itself, there is something called Vision Empower, which is
Yeah, I have
incubated
heard about it.
at
Yes,
Triple
yes.
IT Bangalore.
Hmm.
And there's a lot of work happening at the advocacy level and with the schools to change that scenario. And there are also
Yes,
people
yes.
who are studying now. There are a lot of people who are studying science, technology, engineering, and mathematics now. So things are
Yes.
getting changed. But the only thing is that all of us and the disability organizations should consistently work with the boards and all the
Yes, yes,
stakeholders. If
exactly,
somebody
exactly,
stops
exactly.
enrolling, we need to aggressively work. Okay, and
Yes,
at the
yes,
same time,
exactly,
students
exactly,
should
exactly.
also show a great progress in their education, and they should really show the lot of interest. So that is quite important.
That's very true. Yes,
Yeah.
yes, sir. Doctor Divya,
Yeah.
yeah.
Yeah. Thank you so much, Srinivasu. And yeah, because of course I was not aware about the scenario in Bengaluru. So in my case, even back then, the Maharashtra board, that is the HSC, the Higher Secondary Certification Board, they had some accommodations in place for people who are visually impaired who would be taking science. And instead of mathematics, I had opted for psychology because I was very determined and I had decided that I wanted to go into a medical field. But for those visually impaired people who would, probably want to go in for engineering, would have to consider, whether they want to take mathematics or not. So in my case, for all the experiments, what they would do is, of course, they would show me all the apparatus that goes in the experiment. I would stand by when the professor would do the experiments. But during the exams, they would ask me the name of whatever the apparatus is. So if it is like a measuring cylinder or a test tube or whatever, plus they would also ask me how the experiment is performed and what results you would expect. They would take kind of a viva, I would say. So I was not expected to actually do the experiment. And thirdly, in biology, we would have different specimens. And of course, the specimens would be in a glass jar where nobody was allowed to touch them. So the examiner would tell me what it is, but the examiner would ask me the salient features and you know probably even the differentiations if possible, like within the, say, animal kingdom or plant kingdom, if there are any differences that the examiner expects me to kind of distinguish between two particular similar things. They would ask me to do that. And yeah, even in physics, it was a similar scenario. They would ask me how somebody would, say for instance, organize a circuit and what's resistance and things like that. So yeah, in Maharashtra they had these accommodations, and now it's growing more and more. Now, like Srinivasu said, in even in the field of technology, there are many visually impaired people who are actually pursuing and excelling in mathematics of a very higher level also.
Yeah, thank you, ma'am. The next question is from Shivani. Shivani, please unmute yourself and ask your question. Yes, Shivani, go ahead. Yeah, Shivani, you are audible. Go ahead. Ask your question.
My question to you is that, like, what are the challenges you have faced initially and when you have got your own clinic? How the person approached you, how they trust you?
Yeah, Shivani, your question. We are unable to hear your voice
Yes.
properly. Check your network once. So we will move to another person. After
Sure.
that, we will take in. Yeah, Ganesh is ready to ask for the question. Ganesh ready. Go ahead, Ganesh.
Thank you, ma'am. Very good evening once again.
Good
Ma'am,
evening.
actually, let us know what are the advances in the physiotherapy. What are the problems you faced by you those times, and what are the relief as came through the way of advancements in the technology, and what makes motivates the people who are coming to the physiotherapy. Like what type of technology is their work, but faced by you.
So, firstly, like I was saying, if you look at the academics, when I was studying, like in the mid 2005, in the mid 2000s, it was not so easy, because, like, we did not have many ebooks at that time. But yeah, now I think there's a lot of e-material that is available, not just ebooks, but even a lot of journals and things online. There are a lot of online forums where there are discussions happening. So technology has brought everyone together, I feel. And as far as the actual working is concerned, so if you go to see physiotherapy, there are now very advanced machines that have digital ways in which the machines are controlled. So sometimes they are like touch screen machines where you have to really modify the machine by probably having some bumps or some tactile stickers on them or something. And now, like in Mumbai, a talking IFT, like there's a physiotherapy machine that was developed in association with an organization called XRCVC here in Mumbai. And that's a talking machine. So it would give you feedback of what program you're choosing, what treatment you're giving. So that's a great innovation. And I also have that machine. So, and we are trying our best to make manufacturers aware about how accessibility is important for somebody with vision impairment who is treating patients. So, like me and my colleagues, we are trying our best to make them aware. Now, we also have a talking, like probably even some of you know, we have a talking blood pressure monitor. We have a talking weighing machine. So, I think accessibility is increasing, and there are many techniques. Of course, it's not all about machine, because after all, humans make machine, but after all, what a human being treats is the ultimate. So many advanced techniques are also evolving within physiotherapy that use not only the human hand, but we can also hold, uh, it's called instrument assisted treatment. So that was also a course I did last year, and that was a great course. And so advances are a lot now, and I feel physiotherapy is a great field for a visually impaired person to choose, because, and especially for someone who loves to communicate, who loves to connect to people. And it's very satisfying when you see a patient with a fracture who was unable to walk, when he starts climbing stairs, when he starts going to work, when he starts traveling by train. It's a very satisfying thing. And of course there are uh, some challenges, but of course I feel every field has challenges. It's not that only physiotherapy has challenges. Every field has challenges, every field has competition. So we have to keep ourselves updated. We should know what we are doing perfectly, and we should have that confidence. I feel that whatever I'm doing is the right thing. And of course, we should be open minded to learn a lot from other people. I think learning is a lifelong process, it never ends. So it doesn't end with a degree or something. We keep learning all our lives. And so I think all of us should keep learning all our life. And physiotherapy is a great field for visually
So,
impaired people.
so Divya, one practical question to you. So,
Hmm.
you have to deal with a lot of people who got the fracture or something that happens to them. That is when they come to for physiotherapy. But
Yes,
there would also be a psychological problem with some of them, or actually most of them. Firstly, when they get injured and when they get fractured and all, and as soon as
correct,
they see you as a therapist who happens to be visually impaired, it could also a lot of apprehensions go into their mind. Oh, what happens if she touches me somewhere else and if I get injured further? And that kind of mindset would
correct.
also happen. So I'm pretty sure you may have come across this kind of situations. And how do you address those? And because it actually
Yes.
causes to dual things to them.
Yes, yes. That's a very good question. So, see, the patient may not be disturbed. Like, of course, like you said, the patient can be scared that, oh, this person is visually impaired. How will she make me walk? Or how will she know, whether I'm going the right way, or, whether I'm walking properly? So, I generally make people confident in the environment in which they are first. And of course, every physio has to do that. So when a patient has a fracture in, say, in the thigh or in the knee, and when somebody has not walked for like 4 weeks or so, of course, if the patient is operated, then they start walking in a couple of days. But yeah, if they have had a plaster or something, then yeah, they have to be in bed for quite some time. So generally, the patient is quite scared to stand and walk. And plus, like you said, if the therapist is visually impaired, then there's an added apprehension. But I try to make that person comfortable by keeping that person in and around their familiar atmosphere, like their bed. So I'd probably make them just only sit on the first day along with the other exercises. I'm not very overzealous about making them stand or walk. So going a little slower helps. And plus, supporting the patient initially little more than my sighted peers is something that helped me a lot. So when I was in college, my professors would tell me that, oh, leave him, but I would try and at least keep my hands around the patient, if not on the patient. And that would really sometimes help me, because if the patient is feeling unstable or insecure, they would always know that okay, she's around me and she knows what she's doing. She's aware that she has her hands around me. So that would give the patient the confidence, and that does give them confidence that I can handle them effectively. So yeah, many times we have to design or devise our own ways to win the confidence of people around us.
Thank you, ma'am. Uh, Shivani is trying to ask again. Shivani, go, please raise your hand and I would like to unmute you. Shivani, are you there?
Good afternoon, ma'am.
Yeah,
Good
yeah,
afternoon.
go ahead.
Yeah, sorry, good evening. So sorry for the inconvenience, ma'am, first of all.
No
So,
problem.
ma'am, my question to you is that, like, what are the challenges you have faced initially when you set up your own clinics? Like, how did the people approach you and how did they trust you to treat them and all?
Yes,
Yeah,
correct.
that's all.
So
Well,
when I uh
she's actually started her probably first career in the place that she was living, and she's already kind of a dan in that area, a gangster kind of thing.
oh, मैं हूँ Dawn, मैं हूँ Dawn. Okay, jokes apart. So yeah, so when I started out with my clinic, and even now, I have two people with me who are sighted, and that is not because I'm visually challenged. That's because any physio can have assistants around them. So, generally, if you go to a doctor's office, they would have a receptionist, and then the doctor would be inside. So, it's not that, the doctor is unable to handle the patient alone or something, but it's just that it's nice to have a team so that, when you're treating multiple patients, when some of them are on machines, there is somebody around to just monitor the patient, how he or she is feeling, or it's just nice to have a human being around. So I have two of my staff, my assistants. They are not physiotherapists, but generally when the patient comes, they see to it that they just write down the basic information of the patient, and then the patient comes to me. But yeah, I know many of my colleagues who are handling their clinics alone. They don't have anyone, any assistant or anyone. It's just a question of personal preference, I feel. But as far as the confidence in me that the patients have, I feel the very important thing is to first speak to the patient before even trying to understand their medical condition or something. It's very important to just speak to them about what's happening to them. So that really gives them that confidence that, okay, this person, whether she is able to see or she cannot, she wants to understand my problem. That's something that's very important, and um, that's a sad state of affairs nowadays. But yes, many doctors lack that ability to listen to the patient, and unless you listen to the patient, you cannot treat the patient. That's what I feel. And like Srinivasu just said, there are many times many psychological aspects also of pain or of any particular condition. It's not many times just the physical thing. So once I start speaking to the patient gets confidence in me. And I feel that, okay, we many times we just assume that, oh, the patient can see, the patient can see how I'm moving. But in spite of that, I try my best to tell them that, okay, I'll be coming from you and I'll be coming from behind you and examining you, all right? So I try my best to be communicative with them. I try my best to tell them what I'm doing before I do, and that's how I would like somebody to treat me. So it's very important to place ourselves in that person's you can say shoes, or in that person's situation. And then I think whether you can see or you can't doesn't really matter, because you're actually trying to keep yourself in that person's place, and that's very important. So, and yeah, so that's how it is. And many times, my colleagues used to worry that, my sighted colleagues used to worry that, how will you look at the facial expression of the patient? So that was a challenge for me in the hospital, where, sometimes patients would be, semi-conscious or something like that. But many times there are some things that we can observe, like when a patient is having pain, they would tighten their muscles apart from their facial expressions. So it's very important to feel keenly when you're treating the patient, to have that sense of feel, not by touching the patient differently, but by just getting used to those kind of things. And so I think those things really help me to win the patient's confidence. And I have, of course, learned these things over a period of years, Shivani, like you said, challenges. So, all of us, we learn from our challenges. So that's what I have done too.
Yeah, thank you, ma'am. Next question is from Prashant. Yeah, Prashant, please unmute yourself and ask the question. Yeah, go ahead.
Yeah, good evening, ma'am.
Good evening.
I'm Prashant. So I would like to ask a couple of questions. Ma'am, where do we have more opportunities in this career? I mean, do we have opportunities in Mumbai only, or in the rest of the states?
So by opportunities, you mean opportunities for education or for employment?
Anything, ma'am. Both.
Yeah, I feel if you want to do something, you create opportunities, So as far as education goes, like, even I was not sure initially that how I'll be able to pursue physiotherapy. But if we feel, in English it is said, where there's a will, there's a way. So there are many of my visually impaired friends who are working in hospitals, who are working in trust physiotherapy clinics, who also have their own setups. So there are different sectors in which the visually impaired physios can work. And now, as far as education is concerned, um, you can give the Maharashtra Common Entrance exam. So that makes you eligible to enter into physiotherapy as a visually impaired person. So, yeah, there are opportunities, and it's really rewarding. I won't say it's easy, but yeah, once somebody does it, it's really rewarding.
And also, as far as other places are concerned, there may not be a popular course or especially designed for people with disabilities or something. But if somebody wants to pursue based on this inspiring story, they should actually reach out to the institutes who actually teach the physiotherapy to mainstream and actually have a chat with them, and have a dialogue with them and get started. So it's like not everything will be available as is. Sometimes we also need to put in effort to get started, even if it does not exist, because physiotherapy is something which is available as a profession across the globe.
Yes, very true.
Only it's not that only people in Mumbai get the meet with accidents or get their fractures done. It happens everywhere.
Yeah, very true. Yes, and even in Hyderabad, there are many wonderful hospitals like Apollo Hospital, where there are many like great sports physios, and so yeah, even that side, I can see a lot of opportunity and scope.
Yes.
Yeah, thank you, ma'am.
Welcome.
Yeah. So still, if anyone interested, please raise your hand, or you can type your question in chat box. I will read on behalf of you.
So Divya, do you also sing songs to while you treat your patients to entertain them?
Really,
So when I was doing my internship once, we had a patient who was a Maharashtrian, and she was a very old woman, and like her son was not looking after her, and she was very she was not like poor or something, but yeah, many times we have money, but we don't get that love from our family members. So she was one of them, and so we were just talking about music and bhajans and things like that. So I had a friend with me who said that, oh, she sings very well. You can, which bhajan do you like? And she just mentioned a Marathi bhajan that fortunately I knew. And I was able to sing for her, and she was so happy. And then in a couple of days, I got to know that she expired. So, and that was really fulfilling. I think I was happy that I was able to fulfill one of her terminal wishes. I think so. Yeah, that used to happen sometimes in hospitals, but yeah, in my own setup, I have never tried that.
Yeah, Ganesh, ask your question. Uh, yes, ma'am. One song from you would like to listen. Please, one song.
Okay,
Yeah.
I'll sing a song by Shankar Mahadevanji. गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि गानचतुराय गानप्राणाय गानान्तरात्मने गानोत्सुकाय गानमत्ताय गानोत्सुकमनसे गुरुपूजिताय गुरुदैवताय गुरुकुलस्थायिने गुरुविक्रमाय गुह्यप्रवराय गुरवे गुणगुरवे गुरुदैत्यगलच्छेत्रे गुरुधर्मसदाराध्याय गुरुपुत्रपरित्रात्रे गुरुपाखण्डखण्डकाय गीतसाराय गीततत्त्वाय गीतगोत्राय धीमहि गूढगुल्फाय गन्धमत्ताय गोजयप्रदाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि श्रीगणेशाय धीमहि श्रीगणेशाय धीमहि. Thank you.
Thank you, ma'am. Nice song, great song. Thank you so much. Really great.
Thank you.
And so it's time to end the session. One of our teammate, Mr. Ganesh, give the formal conclusion. This vote of thanks. Over to you, Ganesh. Yeah. We'll take one question, then we'll conclude.
Yeah, sure.
There is a question from Mr. Joseph Garu. So, sir, please ask your question. Yeah, go ahead.
Good evening, Divya. Lovely song,
Good
by
evening,
the way.
sir. Thank you.
Yeah. Once upon a time, I was also a medical transcriptionist, so I understand how difficult the field is. I was wondering if there is any book written by a blind physiotherapist that you know of.
That's a very good question, sir. I'm not aware if there is.
Okay.
Okay, then that
you
is
can
an
read a
assignment
book.
for you, Divya.
Yeah.
Yes.
Divya, then that is an assignment for you.
Yes.
There is
If you want, I'll be happy to set a deadline also. What's your suggestion?
Yeah, you can also write one.
Oh, thank you so much, sir.
There is a book written by Dr. Jacob Bulatin. He was also a blind doctor in the US. The title of the book is
Yes.
The Blind Doctor.
Yes, sir. I've read his autobiography.
Okay.
Yeah, that's really great. Sorry, I actually misunderstood your question. Like, I thought if there's any blind physio who has written a book. So I am not aware of that.
I asked the same question.
But correct. Yeah. But yes, I have read his his autobiography, and that has really inspired me a lot.
So I was wondering, similarly, was there any book written by any physio?
Yeah, that's a good question, sir. But yeah, I'm not aware, and I should find out.
Okay.
Yeah, go ahead and write from tomorrow.
Okay.
And have you treated any blind patient? Just curious.
Yes, sir. I have treated 2 blind patients. Yes, and they have been really cooperative and very good patients, very systematic, and they got better also very soon because they would do their exercises very meticulously and systematically.
Okay. Thank you so much.
Thank you.
Thank you, ma'am. Next question is from Anirudh Garu. Anirudh, please unmute yourself and ask the question. Go ahead.
Yeah.
Your voice is breaking a little bit.
Am I audible now?
Not so. Please go ahead.
Yeah, you are audible now. Okay, go ahead.
Okay. Actually, actually while she was answering my question about this science stream and everything, actually my internet connection broke off.
Uh-huh.
Back in the YouTube.
Yeah, it will be in YouTube. Okay.
Yeah, actually, I came in the. I mean, my connection became proper while she was singing a song. Actually, I thought I have entered a wrong meeting room. Actually.
Okay.
So, so yeah, thank you very much. You know.
Yeah, no need to worry. Always
Thank you.
you can go back and listen the full session again. Okay.
Yes.
Thank you.
Okay. Yes, thank you.
Yeah, thank you, ma'am. Next, Ganesh, over to you.
Still, nobody left, Mahesh.
No, no one is there. You can give the vote of thanks.
Once again, very good evening to one and all. At first, Srinivasana, thank you for introducing Divya ma'am to all our team and as well to many people. Actually, we are thinking about this session actually on November 8th, I think, and on the first week of November. So when we discussed it first in the month of around October last week, Srin said to me that you can put a session in the month of November after first week. So we thought from then, due to unavailability, we are postponing the session. However, we could have we had the session today. At first of all, ma'am, actually it's very inspiring as well informative session because and motivating as well. Our team, DPWD also believes to diversify the people into the different education systems. Then they can get better jobs and they can fulfill their desires. In the part of that, we have conducted many webinars, but into different topics. But when we thought about physiotherapy, we thought that definitely it's going to be uh, make a change or make a put a thing to in the many one's minds. So today almost their doubts came to clear and just they listened your words and they got a different ideology like your education system and how you came across all the education systems as well courses and now how you are operating. So now people may search for more it to gain the more knowledge and how the field suitable to them. So once again, I thank you for inspiring them as well. And to all the people who have supported to complete this session successfully regarding the technical as well as sharing and informing to many people. Hope not only today this 20 to 25 people, it will be useful to many people as we have preserved this session in the YouTube as well. And even it also enabled me and my team to thought about the courses of physio and how people can do and what the types of courses are there. So we are planning to publish some even step by step articles as well in the website that is dpwd.org. So once again, with this, you can came to conclude. However, you can always stay with us by subscribing to our YouTube channel DPWD and even Facebook page dpwd.org. You can follow us and you can always tweet us at Twitter at dpwd.org. So we are never far. So you can always if in case if you got any queries in between as well after this session, you can mail us. That is connect at the rate of dpwd.org. Thank you.
Yeah, thank you, Ganesh. So, guys, the main session is over now. So, we will have a general discussion here. You can give the feedback regarding the session, and you can give the suggestions, and also you can interact with the team.
Full team
Yeah.
as well.
So, we are unmuting everyone. You can. By the way, we leave all our social media handles in YouTube description as well as in Zoom chat box. You can reach us by using our social media accounts. Okay. Thank you all. Have a great day. And we are unmuting everyone. You can interact with us now. Yeah, Sham, stop the live stream.